few over the last few days. The goal of these lives are to better communicate with the people who leave comments on our channel, on our videos. I want to encourage you guys to keep leaving comments on our videos, and I'll do my best to answer in formats like these. As I mentioned in the other lives, that YouTube is not really great at communicating between people, so there's no private messaging like Instagram and so on. So it's not really set up for that. So I'm doing things like this to help out in that process. So as people start to pop in here a little bit, again, I'm going to read from one of the comments that we got about a groin strain. And so this individual was talking about how they overstretched their groin before they have a marathon coming up, and they asked, is it safe to stretch it or not? And there's a few things to consider with this, and I don't know how soon their marathon is, but we have to number one note is there an actual valid reason why we shouldn't be stretching the area, such as having a muscle tear? We really wouldn't want to stretch a muscle tear, at least right now, if it happened today, and probably not even for about 3 weeks for the most part for most people. The reason is because when there's an actual tear, not a strain, they're different. A tear is actually where there's fiber disruption between parts of the sides or the center of the muscle, where they're not really transferring load anymore because they're torn apart from each other. Also, probably important to note too that micro tears are not the same thing. This is actually a large enough tear that you can see it on an image. Large tears you can see on ultrasound and MRI imaging. Strains, micro tears, you will not. And so they're not really the same type of categories, what we're talking about, at least with this. Stretching is not really something I would do early on for an actual groin tear. I met someone recently that they actually, they were playing their sport and they didn't feel a pop, but about a week later they saw a bunch of bruising and discoloration. It was actually yellow when I saw them, and it was yellow on the inside of their thigh. And so they said, "Do you think I strained it?" I said, "I don't know. To me, it looks like you tore something." So in that scenario, should he be stretching? Probably not. These aren't communicating well. But there's other things that could be done, and I did discuss with someone the other day that we were talking about tear options too, and they said, "Do you think this has been about 2 weeks since it happened?" And they said, "Do you think I should do soft tissue work?" And I said, "Well, you could, but what are you going to do it on?" And he's like, "Well, on the scar tissue." I said, "Well, according to the histology, it hasn't really started forming yet. Like, it's usually about 3 to 4 week mark. So you can beat up the area because it's painful if you want to, but it's not really doing anything to the quote-unquote scar tissue or adhesions in the area." But I said there's other things that we can do. I think maybe doing isometric loading would be a good thing for that individual. And so we talked about that a little bit. And he said, "Why would isometric loading help? And then what is it?" And I said, "Well, it's when you're doing a non-movement contraction within a range of motion that does not provoke the issue, and then you challenge the tissue." And so what we've learned is actually this can be done as soon as just even 24 hours after the original injury happened. I did it for my own hamstring. By the way, if you guys are just still popping in, I'm doing these. I'm trying to do these every once in a while this time of morning, because comments on YouTube are not great to respond to. I try to respond to them, and I'd say 99% of the time most people don't respond back. I think it's because they don't get the notifications and alerts. So I'm trying to answer any really good questions this way in a live format. And so if you guys want to start commenting on not only this, I'm driving to work, so I'm only going to have about like 5-10 more minutes here on here. But if you comment on any of our videos or shorts, I'll do my best to include the best ones in formats like this. So isometric loading, at least for that scenario, is a good call, because if we do it right, it doesn't really hurt. And the goal of good personal training or strength conditioning is it shouldn't really hurt or provoke people's problems. It should be hard, it should burn, it should be heavy, but it shouldn't really hurt. And so usually when I coach people into isometric exercise early, number one, we have to reassure them that it's okay after doing an exam. We do the exam to figure out if it's valid in the first place. If it is, we start to do a low level one, like a 30% contraction, and hold it for just under a minute, basically. Like 30, 40 seconds is pretty fair. And then the way we know that it's too much for the person is usually that they'll start to feel their problem. And it's not something that we really want them to feel. Again, you don't have to fight through pain to get better most of the time. And we start to feel the whole muscle as a unit come online. And I'm a testament to this myself. I had a hamstring tear. It was about 12 weeks ago now. If you guys want to look up all of the isometrics and exercise I did for that, it's all on our YouTube. I did, I think, about 4 weeks worth of video documentation on it. And so I did it as early as day one, and it was hard mentally to want to do that because I thought maybe it'd be damaging. But as I started to do it more and more, actually, I was able to walk better. Within a week's period of time, I was actually jogging. The second day, the first day, I actually had a walking stick, and I went to work with a walking stick. And within 48 hours, I was walking without a stick. It was really fine. Like, there's things I couldn't really do super well, but overall, it helped me a ton. I was really surprised. And it's unfortunate that I've met a lot of people who wait a really long time to even start this. Like, they'll say, well, I got to wait 2-3 months before I do anything to challenge that tissue. That's not always the case. If you get a good healthcare provider who knows how to do a good exam, they can deem certain things safe or unsafe for you at that point in time. And then later on, when the tissue becomes more tolerant of loads, then you add it back in. But tissue work later on, I have a lot of interns ask me this: when is a good time for soft tissue work, like your ARTs, your fascial manipulations, your deep tissue work, etc. Personally, I think it's when chronic cases, like somebody who's had repeated hamstring tears or repeated groin strains, that would be a better scenario for it. Again, if you're wondering why, it's because adaptation has occurred. There's been enough time. As we mentioned in the first example, when the person bruised, there wasn't enough time yet. Like with a turned ankle, and you turn it right now, there hasn't been enough time for scar tissue or adhesions to really lay in there and get really sticky. Now, there's going to be people that probably debate me with this. There's plenty of people who do soft tissue work with different intentions for like early onset injuries. I'm not going to say I haven't done it or I don't do it. It's just not top of my list. But it certainly can have some help with managing some of the people's symptoms and pain as well, and reducing compensation or collateral. Now, obviously, we're talking about like what this person said is what's safe to do. Should they stretch the groin? Should they not stretch the groin? Personally, I think loading around it is a really safe thing to do, like loading a different chain in the body, like not loading let's just say they strain the adductor, and strain, sub-level injury, not a big tear. If it bruised, that's what we talked about earlier. But loading the tissue, I'd say one of the biggest mistakes that I see people make is they actually don't always give enough time for that tissue to repair itself. Now, I know I mentioned earlier that you can load it, but you want to do the exam first to assume that it's okay to do so. There's plenty of situations where we don't actually load the tissue that's aggravated, and we load around it. The anterior chain or the anterior sling of the body is kind of like across the front, and it doesn't just encompass fascia, it encompasses muscles too, and they work together. I know when I dive head first I'm trying to steal a base or get back to a base, I feel my abs work, I feel my thighs work, I feel my adductors work, I feel it all work. They all work together. Like, muscles don't always work in isolation. And so normally we load around the chain which is working too hard, such as the lateral chain or the posterior chain. These are really easy things to do, but also I'd say a strong majority of people that I meet, they actually load the anterior chain first, unfortunately, because then they get some aggravation with it. But also, too, they don't know how to load the posterior chain. They don't know how to load the lateral chain, and those are just educational pieces and coaching that they need that they just don't really have yet. I apologize. I see some of the comments coming through. I'm driving, so I can't really look at them all. But I'd say one of the most productive exercises that I've had people do for groin issues is side planks. Side planks are really good for most people as long as they don't load the top leg. Now, on that last part of the question of if you've run a marathon before, you realize you can't just get off the couch and do it, or you can't do it well. We always say that anything's possible with time. And so if we're talking, I have a marathon coming up. By the way, it's tomorrow. I strained my groin recently, like 2 months ago, and haven't run since. There's a slim possibility that you're going to do very well in your marathon. Not to say you won't complete it, not to say it won't hurt. We don't really know that. But you haven't really done appropriate training, right? So if we're able to help this person find safe things to do and get back into training while the clock is ticking, they'll actually do better in their marathon. And if we're only talking about like finishing or performance, not even about pain, because there's plenty of athletes who work through pain because they're a paid professional and they need to do their job. And a lot of those people, they don't always feel good all the time, and they can't just rest forever. So you still have to train around it. So there's one thing which is pain, but also there's tissue capacity or the ability to perform. So I can totally hit a baseball while having groin pain and get on base. If I don't have pain, but I haven't been hitting baseballs, I'm not going to hit the baseball and get on base. So they're two different things. And so anything's possible with time. And so one mistake I see a lot of people make is they just wait a long time to rest the area. They don't seek professional help. They don't get a good opinion. And they don't always take the advice of the person, quite honestly. And they do a little bit of work. They don't do enough work, but they continue to decondition their body, which is unfortunate, because if they wanted to run that marathon, then they should have been doing the training. You have to put the work in. Again, if you're just doing it to participate and finish, that's a whole nother story. You can walk the entire marathon and it's completely fine. Nobody's looking at the time but you. But if you're actually looking to compete, then you need to actually do the training for it. So I hope this format's nice with everybody. Do you see that everybody left some comments? Thanks so much. If you guys